Hello, my name is Kate Ramsey. I'm the Clinical Director for Retreat Behavioral Health in Lancaster County, and I wanted to talk a little bit about suicide in the wake of recent events. As many of you know, Naomi Judd, a very well-known and beloved country singer, died by suicide very recently. And it's important to look at these issues and address these issues, but especially in the wake of the death of a celebrity by suicide. We do see an 18% increase in suicide attempts among the general population after a celebrity passes due to suicide. If the media releases the way in which that person has died by suicide, we will see a 30% increase in attempts in that way of attempting suicide. This discussion can be triggering. We do encourage anybody who is struggling with suicidal ideation, which I'll talk about in a little bit. Thoughts of suicide is passively considering not wanting to wake up or actively considering a way in which to die by suicide, to reach out to the suicide hotline. We will display that information below so that you can contact these people at any time to get help. So let's start addressing some of the questions that come up around suicide. One of the first questions is, who is at risk for suicide? Really, especially now, post-pandemic, with the anxieties and stressors that everyone is enduring with the social political world in the kind of upheaval it's in, many people are struggling with much higher rates of anxiety, depression, other mental health symptoms, and these things, along with isolation, can put anyone at risk for suicidal ideation, which is thinking about suicide, or a suicide attempt if they do not receive help or some kind of intervention. We know that the best prevention is to seek help. Uh, if you are surrounded and communicating with people, it is far less likely for you to attempt suicide than if you are alone and isolated and feeling hopeless. Let's look at some of the other questions that come up when we're discussing suicide. What is suicidal ideation is an important question. Suicidal ideation is anything from what we call passive ideation, which is thinking about suicide in the sense of, I don't want to wake up, the world would be better off without me, I feel hopeless, there's no point to living anymore. Those are all thoughts about suicide, but they're considered passive. There's no plan involved. Active suicidal ideation is when a thought comes of, this is what I would do, down to a very specific plan. This is what I am going to do. This is how I am going to do it. So really, suicidal ideation is a range of thoughts that a person can have, and they should all be taken seriously. It is not healthy to think, I don't want to wake up tomorrow. If you're having those thoughts, please reach out to a professional and seek help, because we don't want those kinds of thoughts. I don't want to wake up tomorrow to escalate into, this is what I'm going to do so that I do not wake up tomorrow. What are some warning signs that a person may be suicidal? This is a very complex question. I think first off, any changes in behavior patterns, any sort of isolation, statements of hopelessness, statements of not wanting to be here anymore, any sort of giving away of items. We'll often see this with people who are starting to think that they will attempt suicide, is they'll start giving away beloved possessions. If a person isn't future thinking, so if you ask someone you love, hey, what do you want to do tomorrow? What do you want to do next week? And they're like, I can't even imagine what tomorrow would look like. I can't even think of next week. Those are concerning signs. They can be. And it's always really important to seek professional help, because suicidal ideation, thoughts of suicide, it's a very complex issue. It's not for the average person to make a guess at. You need to get professional help so that you're not going through this alone, so that your loved ones are not going through this alone. What age groups are at highest risk for suicide? So we know that men have a higher rate of completion than women. We know that among teens, the suicide rate is very high, but something that Naomi Judd's suicide brings to the forefront is the rate of suicide in the elderly. Uh, Many people think that once you reach a certain age, you're not at risk for suicide. And in fact, one of the highest suicide rates among all age groups is elderly men. It's often due to illness, due to loneliness, due to isolation, but we do see these higher suicide rates among the elderly. So, again, connection is so much part of the solution. Making sure that you're checking on the people you love, and that if you're somebody who's older and feeling isolated, that you're reaching out, that you're connecting with other human beings. That's the best way to stay safe and stay grounded. And it's also really important to connect with professionals. How can I help someone that is suicidal? First and foremost, if someone is actively suicidal, immediately to the ER. Do not pass go. Do not collect $200. Get that person to the ER for an evaluation. When you go to the emergency room, your loved one will be asked a number of different questions and assessed to determine what level of care is best for them. It may be determined that the person needs to stay inpatient at the hospital. That's one of the highest levels of care. They may step down to a more moderate inpatient level of care where it's not a locked unit, it's not hands-on, but it is a safe place where that person can be stabilized and learn the skills they need to stay healthy. It could be outpatient treatment, being assessed by a psychiatrist and meeting regularly with a therapist, but it's really important to get that clinical assessment. After that, it's important, and I can't say it enough, connection. One of the things that studies have found that's really helpful in this day and age is just sending quick little text reminders to the people you care about that you're out there. Just saying, hey, love you, here's a quick clip of something I saw. It's these little reminders that help people who are feeling hopeless and helpless to recognize, oh no, wait, I am loved and I am surrounded by people who would miss me if I was not here. However, I don't want to make it seem that, oh, if you say hi to the people you love, they'll be safe. Um, Suicidal ideation and suicidal depression and that level of hopelessness, there's a lot going on biochemically. There's a lot going on that a psychiatrist can assist with to help raise the level of that depression out of that suicidal level. This isn't a pull up your bootstraps and cheer up, everything will be better tomorrow. This is a clinical issue that needs clinical and psychiatric treatment. So it is important to be supportive of your loved ones. It's important to be supportive of yourself and practice good self-care. But if you're in the throes of suicidal depression or any level of clinical depression, you need professional help. What treatment options and forms of therapy are available? So I already talked about a few of those. There are different levels of care, from a locked unit where you cannot leave to harm yourself, to an inpatient level of care that is an open unit, to outpatient care. It really has to be determined through a very complete and thorough assessment what is most appropriate. And I think a lot of people don't reach out for help because they're afraid they'll be put in a locked unit, or they are afraid they'll have to go inpatient, or there's a lot of fears with coming out and saying, this is how I feel at risk. But ultimately, we want to keep you alive. The world is going to be less if we lose you or someone you love to suicide. So we want to connect you and the people you love with the help that they need. Please get in, get assessed, and take the risk. It is much better to go to a level of care that you're feeling a little iffy about, but live to see another day, than say, nope, I can do this myself in my own room, and then find yourself at much higher risk of suicide. What should I do if I am in crisis or someone I know is considering suicide? Again, go directly to your ER, contact the Suicide Prevention Lifeline, which we will display. It is really important. A lot of people hesitate to call because they're like, well, if I call and ask for help, then I'm not really suicidal. Good. We don't want you to be at the point where you're at the edge of the cliff and ready to fall off. If you're thinking about it, let's stop it there. Go to the ER, call the Suicide Prevention Lifeline, find the level of care for you, and make sure you heal. Remember, a big part of this is what's going on biochemically in your brain. We need to stabilize, we need to get the chemistry running properly, and we need to get you the help to address all the underlying issues that can drive that feeling of considering suicide, whether it's anxiety, depression, anger management, hopelessness, the fact that we've all been isolated for the last 2 years. There's a lot of reasons to have these thoughts, but we want to get you the help you need for where you're at so that you don't reach that point where you're about to fall off that cliff. I want to thank everybody who jumped in to listen to this. Suicide is a preventable death, but it is a challenge because it thrives in secrecy. Please, if I haven't said it enough, seek that help and take care of yourself, take care of your loved ones, so that we can all live to see a brighter day. Again, I'm Kate Ramsey, Clinical Director for Retreat Behavioral Health. Thank you so much for joining us.